So these are my findings from my literature review. I decided to do my literature review on Alzheimer's for many reasons, mostly because Alzheimer's is a trend in my family. Um, it's a progressive neurological disease. It's the most common type of dementia. It makes up around 80% of dementia cases. And it's caused by amyloid plaques and tau tangles in the brain. Um, we don't really know why these abnormal changes start happening. Alzheimer's is not just a normal part of getting old. You're not bound to get Alzheimer's once you reach a certain age. Um, you can be 90 years old, like my grandmother, and still not have dementia of any type. So, when it comes to treatment so far, we don't really know a lot about this disease. Like I said, we don't even know why the abnormal protein forms start happening. Um, it's mostly treated with pharmaceuticals and different medications. However, these medicines are very expensive. All treatment for Alzheimer's came together to be about 159 to 215 billion dollars just in the United States. And there's no cure for it. Like I said, we don't know much about this disease, even though it's so common. And so that got me thinking with all of our lectures and specifically like when we were talking about different exercises for Alzheimer's, what benefits could this have on cognition for the patients? So, if it's working in tandem with medication, could it be of use, like of significant use? And what I found, it is fairly promising. For different studies, I found that for the most part, people saw at least a decrease in cognitive decline in their patients. They used different tests. The most common two that were used were the mini mental state examination and also the Alzheimer's disease mini assessment scale cognition. This is used for it's usually used to show how progressive the Alzheimer's is. You can see an example of the mini mental state examination off to the side. It's a very quick, kind of scale of 1 to whatever of how bad these symptoms are. And then at the end of the examination, they add up the tallies and see exactly how high the score is to determine whether or not it's mild, moderate, or severe Alzheimer's. Some common modes of exercise, cycling was used a lot. I also noticed, however, with cycling, all of these studies were headed by the same person. So that might just be Dr. Yu preferring cycling over other forms of exercise. Maybe it's a safety thing, maybe it's just, maybe they just have the most access to stationary bikes. All I noticed was that you really prefers cycling over any other form of aerobic exercise. And others prefer just having a variety of exercise. They had treadmills, cycling, other like recumbent forms. So when it comes to mode of exercise, it seems it didn't have any effect on whether or not the patient got better or not. They all had the same outcome, as well as whether it was in intervals or if it was a continuous exercise. All that was the main trend was if they were exercising, they did have benefits to their cognition. Even if it's not, none of the patients got better, but it did slow down the decline of cognition. And that was what was piquing interests in experts. So another reason, like I said, we don't really know why aerobic exercise can help with cognition, but some had theories and they decided to test these theories. One was VO2 peak, maybe that has a direct relationship with cognition in these patients. Another theory was maybe it had something to do with increase of blood flow in the cerebrum of the patients. Maybe since there's more blood flow, it helps with cognition. However, neither of these studies were able to find a correlation between these two, VO2 peak and cerebral blood flow, with cognition in their patients. So when we're asking, like, why does aerobic exercise help, we still don't know. There's still that unanswered question of how. Another question that was asked among experts was how much exercise? We have this um, dose and response curve. Where does exercise, aerobic exercise, fall in that curve with Alzheimer's patients? And we had a study that had 3 different um, experimental groups. One had 75 minutes of exercise per week, and then they just increased it for the other 2 groups. And what was found in that study was just simply the higher the exercise dosage, the higher the benefits. Um, it's still not specific of whether or not how much. It could be different for every patient. However, when it comes to for the best benefits, exercise 250 minutes a week. We don't have a specific number. So even that question, though it was kind of answered, it's still very vague. And it also, we don't know when a plateau effect happens and the exercise dosage becomes too much. We don't know the answer to that question. So in the end, what I have concluded was aerobic exercise for treatment of Alzheimer's in tandem with pharmaceuticals. It is promising. We do have studies that show that this slows cognition. None of the studies that I have showed significant decrease in cognition. It slowed down the decline, which may not be optimal. However, it is a good start. Um, Again, there are many questions that haven't been answered, such as the dose and response curve, and also the best mode of exercise or the best, you know, uh, way of working it in tandem with pharmaceuticals. However, if we keep asking these questions and keep finding studies for this question, especially how it helps, hopefully in the near future, we can answer these questions. And maybe we can even find a way to stop the decline of cognition in Alzheimer's patients. Hopefully. That's the biggest word for today, is hopefully, with advances in medicine and exercise science. And my sources.